Olá, meu nome é Nelson Caserta, sou presidente da Sociedade Paulista de Radiologia e é um prazer estar aqui com o Dr. Carlo Catalano, que o Dr. Carlo Catalano, desde o ano passado, é membro honorário da Sociedade Paulista de Radiologia e também foi presidente da Sociedade Europeia de Radiologia até o começo do ano. E é presidente também do Departamento de Radiologia do Policlínico, professor de Radiologia na Universidade Sapienza de Roma e tem mais de 10 anos de experiência como coordenador do programa de treinamento em Radiologia na Sapienza. Dr. Carlo Catalano, it's a pleasure to receive you here. Thank you very much for your presence in our meeting. And the subject of our talking is how is the medicine in Europe? How do the persons, how do they begin to study medicine? It's interesting. If you could say some words about this formation of the doctor in Europe, it would be very nice to begin our talking about the education, medical education in Europe.
So first of all, thank you. It's a great pleasure to be again here in Brazil, Sao Paulo, a fantastic congress, and congratulations for the organization. For what regards education in Europe, medical education, so you have to know that Europe is made of 27 different countries, and each country has totally different rules, totally different legislations. So each country is very specific for what regards medical school, for what regards training, for what regards profession of being doctors and radiologists. So I will bring you some examples of some countries because probably they can provide you some ideas. For instance, I'll bring you the example of my country, Italy. In Italy, medical school lasts 6 years. To get admitted to medical school, you have to pass an exam, which is a national exam, and only few are admitted. The number of doctors that are needed is made by the Ministry of Health together with the Ministry of Education. So every year there is a slight difference in terms of how many doctors are needed, and therefore the number of admitted students to medical school. And about the same is also in other countries. For instance, in Germany is the same. There is a limit in numbers of medical students admitted every year. In France is also the same. And basically in every country for what regards medical school. Generally, in most countries, medical school lasts 6 years. So generally after high school, which in most countries finishes when students are around 18, 19 years old, we can start, and they can start medical school. So 6 years. In these 6 years, they do probably as in almost every other country, they do at the beginning general topics like physics, biology, and chemistry, and all the others. And then in the last 3 years, they go into more clinical subjects and topics. Once they've completed their medical school, their medical degree, there are exams to enter the specialty and the training programs. For instance, I go back again to Italy. In Italy, there is a national exam, and the same is, for instance, in France, in which students can apply, and depending on the results of this exam, they can choose, first of all, the specialty, and then after that also the university where they can go to perform their training program in a different specialty. Depending on the quality of the school, of the training program, and depending also on the interest that the medical students have for a specific specialty, they can have access to one or the other. In general, In Europe, radiology is ranked among the highest in terms of interest of medical students, of young doctors. So it's a little bit complicated to enter radiology training programs, but this is really, there are differences. So this is the general situation for what regards medical school. Um, Depending on also on the different countries, the completion of the studies may be different. For instance, in Italy, you have to prepare, and students have to prepare a thesis, and then discuss the thesis in front of at their university to pass to get the diploma. In other countries, there is no discussion of thesis, and it's just the completion of the studies. So it's different depending on the different countries. What we have seen in the past, also depending on the fact that there are some difficulties to enter medical school, is that there is lots of students that go to other countries, and there are a few countries that now are offering medical studies also for non-residents. And so there is a great diffusion of medical school given in English as the language, official language. Otherwise, for instance, in Italy, courses are given in Italian, even though we also have courses in English for foreign students. And in France, they're given in French, German in Germany in German, and so on. So each country has its own specific course with its own specific language.
Okay, interesting. You have said one something interesting. You said that there is a national exam for the student to enter in the school of medicine.
Yes.
Is this national exam for all the universities, to all the faculties? And another question, is there private schools of medicine in Italy, or
Yes.
only state?
No, there are in Italy we have mainly up to a few years ago, there were just state universities. Due to the fact that it's become extremely difficult for them for students to enter these schools, there has been an increase in numbers of private medical schools. But even if there are private medical schools, the number of admitted students is always defined by the government, by the Ministry of Health and Ministry of Education, depending on the number of of doctors that are needed. So there is no independency in terms of how many admitted students we can have even in private medical schools.
And does it varies during the year, for instance? And 1 year you have a lesser number of students, the other year may increase, or does it have some variation according the region of the country, or it's always the same?
There are some variations, even though they're very small in numbers. Generally, we see variation over a long time of many years, but otherwise the numbers are generally stable. There are no major differences.
Okay. And specifically on radiology, and how is for instance, in Italy, the program of how many years the radiologist should do? And also, do you have voluntary specialization after sub-specialization after you finish radiology formation? Because here in Brazil, usually we have it's necessary to do 3 years, but all the residents do the 4th, even 5, depending on the area. For instance, interventional is more 2 years. How is this in Italy or in Europe? You know,
yes.
Do they have years, specifically 3 years, for instance?
Okay, so in Europe, generally in Europe, the average training program lasts 5 years everywhere. There are a few countries in which is shorter, so 4 years, but none is less than 4. So the minimum is 4 years. And the European Society of Radiology has conducted a study that was funded by the European Commission, so the government of the European Union, to define exactly the criteria for training programs, with the aim to leverage the quality throughout different countries. So the aim of this study and this funded study was, first of all, to understand how many years are needed. And the result is that with the current knowledge that trainees and residents must have, we should have a 5-year training program in radiology. There are a few differences among countries, and the curriculum is generally different depending on which country you are in. And in some countries, and Italy is one of those, there is some independence of the different universities in providing the curriculum. So the curriculum is not the same everywhere. But even for this, the European Society of Radiology has developed over the past years the so-called European training curriculum, which is based of 3 different parts. So there is the European training curriculum part 1, which is dedicated to medical studies. So the teaching of radiology during medical school. So in order to provide the same level of knowledge to medical students. Then we have level 2, which is for the trainees during residency, and this again is divided in 2 parts. And then we have a third part, a more advanced part, which is for, let's say, a subspecialization, and in the different fields. Subspecialization is not needed in any country, but as here in Brazil, many students want to also take a subspecialization, or what, if we want to call it, a fellowship, which may be different in terms of length, depending in the country. So in some countries it's 1 year, in some others 2 years. But this really provide an added value to the radiologist by the end.
Okay. In fact, in Brazil, many residents, I think almost all, they want to do a sub-specialization because the concurrence is very large in big cities.
Yes.
So this is a way of differentiate their knowledge among them.
Yes.
This
yes.
is a thing. I think in the future we will follow this way, that it will be almost necessary to do this sub-specialization. Yes. One thing interesting is in Brazil, they are thinking for all the physicians that they finish the medicine school, that they could work for government after 1 or 2 years, because of it's a big country, so there are some areas they need doctors. In the past, they tried to bring doctors from other countries, but it doesn't work well. Is in Italy something like this? For instance, finish your medical school, you have to work 1 year, or I don't know if the military service in Italy is obligatory.
Not anymore. Not anymore.
Here until, but you may change. You may work for the armed forces.
Yes.
During 1 year. You
Yes.
may do this because the number of doctors now is larger than they need. So in my time, you were select, they pick up you and you go
Yes.
to work for 1 year. Does this exist in Italy? Because I know that in Italy, also in many countries, some areas they need more doctors than the other, and
Yes.
some
Yes.
it's I understand that the doctors, they want to stay near the technology, near the area where they could work the medicine as they learn, but sometimes it's not possible.
Yeah.
Does this exist in Italy? You may work, for instance, in another area because the government say you you have to work for the government 1 year, for instance.
Okay. In Europe at this time, and there are three articles that were published in Insights into Imaging that are extremely interesting because they show the results of this study. So in terms of numbers, currently in Europe, in terms of radiologists, depending on the different 27 countries, and exactly showing how many there are, and what's the mean age of the doctors, and also how many are needed in the different countries. So what comes out is that in most European countries, there is a shortage of doctors in general and also of radiologists. There are a few countries in which is particularly evident, some others in which is less evident. But at the same time, in those countries in which the number is quite high, the mean age is very high. And for instance, again, I'll bring you some examples. The average number of radiologists in Europe per million inhabitants is around 150. And in some countries, France is one of those. UK even worse. The number is less. In some others, and Italy is one of those, the number is higher. The number is higher than that in Italy, in Sweden, in Greece, and a few others. But at the same time, the mean age in Italy of radiologists is very high, meaning that in the next few years they will retire, and therefore there will be a shortage of radiologists due to the retirement of those ones. So all the governments now are defining the numbers that are needed. In these articles, it's also shown what are how hospitals and governments should calculate how many doctors are needed, depending on the number of scanners, depending how large the department is. So this is something that we are trying to promote and define exactly the numbers needed, because there is clearly a shortage of, let's say, in general, healthcare personnel all over Europe. For what regards specifically radiology, the shortage is about everywhere, and this is one reason why the European Society of Radiology is trying to promote all new residents to take the European diploma in radiology, so that this would be a certificate for them to move from one country to another one, and specifically going to some countries in which there is a shortage of radiologists. There are some countries, and Italy, again, is one of those, in which there is a clear separation between doctors that work in private practice and doctors that work in public hospitals. So if you work in public hospitals, you are not allowed to work also in private practice, or with some restrictions. Italy is one of those, France also, and Germany also, with some limitations. So the numbers sometimes seem to be high because there is this, it's not allowed to work in private and public at the same time. Everywhere in Europe, there is this difficulty that in some rural areas, there is a clear shortage of healthcare personnel, doctors, and also radiologists. And this is something that it's really increasing, and because, as you said, many doctors, and especially young ones, do not want to go and work in rural areas. And this is probably one of the major difficulty that we have now in allocating the jobs in the different areas. So now we're trying to promote those jobs, but it's really difficult. Not too many people want to go and work in those areas.
This is a common problem.
Yeah.
And a curiosity, when the student finish medical course, is he allowed to work as a doctor even if it is not has a specialty, or he has to do an exam to permit him to work as a doctor? Because, for instance, in Brazil, lawyers, they do not are allowed to work because there are a great number of faculties, and they are not allowed to work without this examination. So they finish the course, and many of them, they don't work anymore because they don't want to do this examination. In medicine, when you finish the medical school, are you allowed to work as a doctor in any country or any city in your country, for instance?
In Europe, again, the legislation is different depending on the different countries. So each of the 27 countries has a different legislation regarding this. In any case, in most of the countries, after medical school, you have to take an exam and pass the exam before starting working. In some countries, during COVID, because there was a huge need of doctors and in the different areas, what was done is that there was a slight change in medical school so that all the medical students could practice and do their practice during medical school, and therefore when completing the studies they could start work right away. But that was due only because of COVID, and there was the need of doctors. But otherwise, now in most of the countries, after completing the studies, you have to pass an exam before starting working. For what regards, and you can be a general doctor, a general practitioner. But if you want to go into a specialty, that's a different story. And in most countries, if you want to work as a specialist, a surgeon, radiologist, an anesthesiologist, you must do and complete your training program, your residency program.
You know that in Brazil recently they have proved in Congress a law that is almost will begin in next years, that all the doctors after finish the school, they have to do an exam, because until now you are allowed to do a brain surgery if you want, but it's of course
Yes,
no one
yes.
do this, but you could do this, and they have changed because of the great number of new schools of medicine. Recently they opened many schools, and because of this, instead of limited the number of schools, they will do the exam at the end. So at least this will be done.
Interesting, yes.
And one thing I would like to ask about the formation of radiologists. In my school, for instance, we had begin at the beginning of the school, the first year of residence. You have to learn general radiology. You go, even for in my time, you had to do how to do the exam, general exam, also contrast exam. You had to do this.
Yes.
And now there is a tendency of many of the students, residents, they don't want to do this. They don't want it. They want me to stay more in the computer, in front of the screen. So it's interesting because I know that if you know general radiology, it helps to begin increasing your knowledge. But now there is a tendency in the first year to ultrasound, even CT and everything. How does this work for instance, in Italy or other countries? I know that there is necessary to do some flexibility, because it's not so necessary to know how to do the exam. I know to do this because I was that time.
Yes.
How does it work
Yes,
there?
so let's go back to the European training curriculum. European training curriculum clearly says in all these parts that the resident should also know how to do an exam. So not only reading, but also how to do it. And I think that I agree with you that this is a very important part for any modality. So you should know how to do X-rays, ultrasound, CT, MR. But so also know the technique, not only reading the cases. So it really depends. In my school, in my training program, residents during their time, their training time, they are also asked to be in the different sections and so follow the exams and know how to do it. So not only making reports, but this is still not very clear, and depending on which school they are studying. But there are slight differences. But in general, we try to maintain also how to do it, not only how to report, but also how to do it.
And another interesting thing is how does it work, the contrast examination? Oh, for instance, upper GI or enema, barium enema. We have some difficulty to maintain people doing this. Only in pediatric radiology they do this, but in general there is a resistance.
Yes.
Oh, I don't like this, but it's necessary to do this. How is
Yes,
the sensation there?
yeah, it's about the same. Residents want to go to CT and MR right
Yeah,
away, but even though I mean the indications for contrast GI exams is really less than it used to be in the past, I still think that it's needed for some indications, and it can provide many information. But the problem at this time is also that the number of these kind of exams is less and less. So it's difficult for residents to see enough number of these exams because the numbers of requested exam is getting less every day, every month. But we try to do it, even though the indications clearly are much less than they used to be in the past.
Okay, we are coming to the end of our interview, all talking. Yeah, just one practical question. And sometimes we do the colonoscopy. In our country, colonoscopy usually is under the hands of the surgeon or gastroclinic or
Yes.
something. And sometimes it's not possible to finish the colonoscopy. What do you do in this? Is common to do computer tomography colonoscopy, or for instance, in my school we have a gastrocentrist, a center of Brazilian Japanese. They did this, and if you is doing a colonoscopy, you finish, you immediately send to the CT. No, not CT, to the enema.
Okay.
Enema, and now it's beginning to do the CT colonoscopy. For instance, I have my relative, he did this, he did a colonoscopy, a virtual colonoscopy. How you do this? You have until now enema, or you finish everything?
We don't do too many barium enemas anymore. We do more and more virtual colonoscopy. So generally, the collaboration with the gastroenterologist, with the endoscopist, is such that if there is an incomplete colonoscopy, they will bring patients directly to our department. The bowels are generally already cleansed, and so we do the virtual colonoscopy. And it's a very simple exam, very smooth, and generally it's the easiest way to do it.
And just the last one question. It's interesting. How is the frequency of a patient in general? For instance, we have some public hospital in Brazil. It will take time to schedule an exam. So you may wait for weeks until you do, even months to do an exam. And even we have a SUS, is a national system of health, but depending on the city, you have difficult to schedule exam. And sometimes high level, other time is difficult because there are a small number. How does this work? Is the same?
Yes,
Or?
yeah, it's exactly the same. In all different countries, the waiting lists for exams in public hospitals is extremely long. So the governments are investing some money to promote the or incentive somehow the doctors to work more, to do extra hours, to work on weekends, to do outpatients, but still the numbers is very high. I think in general, the main problem that we have is that the indications sometimes are very, very poor. And so we do a very large number of exams that have really no value. Still, I think that the numbers now say around 40% of the exams have really a very limited indication. So my idea is that rather than working and doing too many exams, an excessive number of exams, probably we should work much more on decision support and define exactly which are the really indicated exams rather than scanning everyone like crazy.
Okay, Dr. Carlo, we have to finish. We have our time. Thank you very much for talking. It was very good to hear about the. I know that many persons are interested in know this. It's part of the knowledge of this world, connected world, and we know that many things are common between us. Thank you very much.
Thank you. It's been a great pleasure. Thank you. It's been a great pleasure. It's been also a great pleasure for me to listen to you saying which are the differences between Brazil and Europe, Italy, and I think there is. This is really inspiring also to understand exactly what we can do to also help reciprocally one with the other. Thank you.
Thank you very much. Thank you.
Thank you.
Thank you.